I'm Deacon James Carvajal, the Chief Executive Officer of the Catholic Community Foundation. Since 2015, the Catholic Community Foundation Giving Circle, with the generous support of its members, has awarded more than $1.4 million in support of our shared values of care, community, and life. This year, that spirit of generosity continues as 20 organizations were selected to participate in our Giving Circle Pitch Day. You're about to watch a short pitch from one of those organizations sharing its mission, the work it's doing to serve others, and the financial support needed to continue that work. The Giving Circle exists to bring people together around shared values and a desire to make a lasting difference. We're grateful you're taking this moment to watch, listen, and reflect on the important work being shared.
9.9% of Metro Phoenix residents have no health insurance, meaning that nearly 500,000 people cannot afford access to health care. Recent changes in the Affordable Care Act could double those numbers for the Phoenix area. Without ongoing care for conditions like diabetes, heart disease, the uninsured are at risk for severe complications and costly emergency or inpatient hospital bills. Lack of access to affordable health care also contributes to lost wages, inability to pay rent and utilities, food insecurity, and overall family instability. When 16-year-old Jacqueline visited our clinic with her mom last fall, they were desperate to find answers for her recent health problems. She had not been her usual energetic self for weeks, and she was getting worse. Our medical director saw Jacqueline and suspected immediately that she was severely anemic. He gave her mother an order for lab work and said, "Go right away to the lab." Dr. Smith got a call that evening with a critical hemoglobin value of 3.9, indicating that Jacqueline had a potentially life-threatening condition. He told her parents to take her to the hospital immediately, and she spent 4 days there receiving treatment and blood transfusions. A week after discharge, Jacqueline saw Dr. Smith again. She was still weak, but feeling much better. Her family couldn't afford the medications prescribed by the hospital, and so our pharmacists worked to get her those meds at a fraction of the cost so that she could heal. She returned to the clinic for visits until her labs were normal. Today, Jacqueline is an honor student back at school, feeling great and doing the things that any normal teenage girl would want to be doing right now. Mission of Mercy's cost to get Jacqueline the life-saving care that she needed and deserved was just $64 per visit. With a grant of $15,000 to cover prescription medications, medical supplies, and equipment for our clinics, we can provide 234 comprehensive care visits for patients, maybe not just like Jacqueline, but in need and worthy of compassionate care. We're asking the Giving Circle to join us in restoring dignity and healing through God's love by supporting free medical care for the underserved. Thank you, and God bless.
Thank you for taking the time to watch this presentation. You've just seen how organizations like this one are answering real needs and bringing care and hope to our community. If what you've seen resonated with you, there's a meaningful way to help continue that impact. We invite you to become a Giving Circle member, to vote, and join a community committed to the shared work, together helping decide which organizations receive financial support. To learn more or become a member, please visit ccfphx.org/Giving Circle. Thank you for being a part of the shared work and for helping make a lasting difference.